Dr. Kulla here with Synergy Wellness, Chiropractic and Physical Therapy. Today we have Michaela. Michaela has allowed us to film this being done and talk a little bit about her condition, right? So, Michaela, do you want to talk a little bit about what you suffer from and why we're doing this laser?
Hi everyone, I'm Michaela and I have epilepsy. I went through brain surgery and unfortunately that didn't work. So Dr. Coleman suggested to do the laser on me and he volunteered, and so far it's been working.
She also suffers, just to add a little bit to that, yes, she had brain surgery. She's not just having seizures regularly, she's on medication for that as well, and it's really not working. And she's been on this medication for years, but also since the surgery she has had vertigo and dizziness. So is that right?
Yes.
Okay, and then also headaches as well,
yes,
right?
Yes, and mental illnesses, and as well as back pain, and Dr. Coleman has helped me with that.
Yeah, and we've already, what this video is about really is just the laser therapy for vertigo, which would be dizziness or even tinnitus, and also for her seizures, okay? And what we did was, for years I've been trying to get her to do this. Insurance doesn't cover this typically, the cold laser. It's considered experimental, especially for epileptic seizures, but we now know that it does so much more than what it's FDA approved for right now, which is carpal tunnel syndrome, and that's it. So we're really addressing right now the seizures, the vertigo, dizziness, the tinnitus. We're not really addressing so much on this laser therapy her neck pain and her back pain. We've already dealt with that with her tension headaches. Those are pretty much a done deal. I mean, we've already fixed a lot of those issues that she has. She's a student, so when she overdoes it with school, sometimes she gets a tension headache from time to time, but they're much better, am I right?
Yes.
Okay, so we're gonna go ahead and show you what we do for tinnitus, vertigo mainly, and seizures, and go ahead and lay back. There's specific points, and it's really important for the practitioner to know exactly how to use these lasers. It's great to have them, but really to know how to use them is the key. And we're going to hit a couple of points. You're going to close your eyes. Okay. I'm going to hit a couple of special points here, and Michaela, make sure your eyes are closed. We have safety goggles on also. And this is the SPG. We're going to just hit a few points here. I'm not going to get into all the details of why certain points are important because it differs for each patient. We have to do an exam and a workup to determine what areas and what points we want to use with cold laser therapy, and also what strength. This is the first FDA registered Class 1A cold laser on the market. It does a lot. It's a great tool. And so far she's, well actually I'll let you tell them, Michaela, in just a minute. Kind of exciting news. We're 3 weeks into treatment, and she'll give you an update on how the vertigo has been and also how the seizures have been. So we do a minute on each point. And it's a little acupuncture point that we probe that we put on the laser. This is a brand new MR5 Active Pro cold laser. This laser, again, like I said, the first FDA registered Class 1A laser on the market. You can even change the not only the frequencies but also the joules being outputted, but also the strength of the laser. You can switch it from 25 to 50 watt. It's a great tool. Now, we're going to have her sit up and swing your legs to the left there. Okay, you're going to sit to the right a little bit more. Just scoot over to the right. There we go. Okay. So those were some points more for the vertigo, and we're just going to go right behind the mastoid here and do a minute there. And overall, I'd say this procedure takes about 10 minutes to do. It's painless, it's safe, it's a lot safer than the medications she's taking. And to be honest with you, when I first met you, Michaela, you were a little bit of a zombie, walking around, just sort of, it seemed like you were constantly tired.
It's true.
It's true. So why don't you tell people over the last 3 weeks, keep your eyes closed and nobody can see under the glasses there. These are special glasses that we use here when doing the laser. But go ahead and tell me a little bit about the last 3 weeks. Have you had any seizures?
No, in the last 3 weeks, I've actually had more energy than I ever had.
Okay, good.
I've been seizure free.
Seizure free? Okay.
Yeah.
How often were you getting seizures? How many would you get in a month, typically, in the past, before
at
this
least like
procedure?
4 in a month.
4 seizures a month on the medication. Right now, the last 3 weeks, she's had 0. So we're going to check in again in a couple of weeks and see how she's doing. This whole process is going to take 4 to 5 weeks max, and we'll be sure to check in with Michaela. Michaela, I want to thank you for showing everybody, what this procedure is like. Okay. We're going to hit a few more points. I want you to see there's a few more points that we hit here, and we do a minute in each spot for her. And this is dealing more with the vertigo, and we're going to get inside the ear with this probe in just a second. If you have any questions about cold laser therapy or what it's used for, because it's not just used for seizures and vertigo, it's used for so much more, especially soft tissue injuries, nerve pain, fibromyalgia, lymph drainage. We have a patient that has poor circulation in her leg, a lot of swelling in the ankle. This helps to improve circulation. So it's a very powerful tool. And now we're going to go into the ear, just a little bit into the ear. You doing okay there?
Yeah.
Okay. And we're going to hold that for a minute. And I'm going to do this bilaterally, so we're going to do this on the other side as well. A minute at each point, behind the mastoid, in front of the mastoid, and inside the ear. One more minute here, but you can see here it's completely painless, right?
Yes, pain-free.
Okay. So again, if you have any questions about cold laser, or seizures, or vertigo, feel free to contact us or comment below. Thanks, and have a great day.